What is MPS II?
MPS II, also known as Hunter syndrome, is a rare genetic disorder.
The body's not able to make a specific enzyme inside. And when they're not able to make that enzyme, they're not able to break down different byproducts that the cell makes. And therefore, those byproducts build up inside of the cell and then cause damage to multiple organs in the body and eventually can cause death.
There's children dying every day from this disease.
MPS II, also known as Hunter syndrome, is a rare genetic disease. It affects only 2,000 boys worldwide. There are several types of MPS. In each type, the child is missing a specific enzyme. MPS II children are missing iduronate sulfatase. This enzyme is a chemical the body normally makes that breaks down very large sugars called mucopolysaccharides. As the cells in the body go about their daily life, they make these sugars. The cell stores the waste sugars in the lysosome, where the enzyme would normally break it down to dispose of it. The sugars build up and clog the lysosomes, making it hard for the cell to work. Damage to the cells affects the body in many ways. Intellectually disabled, enlarged head, poor vision, coarse facial features, hearing loss, speech delays, carpal tunnel, skin lesions, breathing difficulty, cardiac disease, enlarged organs, delayed potty training, stiff joints, short stature, significantly shortened lifespan.
Right now there's Elaprase. It's a weekly infusion. It gets the enzyme that the kids are missing in their cells, but it only lasts for 3 days before the liver processes it out. It's an extremely expensive medicine. For a vial, it's around $3,500. There's a large portion of medical companies that don't pay for it.
The enzyme replacement therapy involves intravenously administering the enzyme into the body. Typically, a port is installed due to the frequency of this treatment, which is usually administered once a week. It takes approximately 4 hours per treatment for the enzyme to be delivered. This treatment helps cells acquire the missing enzyme for the lysosome to function properly. The effects of the treatment tend to last a short period of time, and some patients suffer from side effects from the treatment or the process itself. Unfortunately, the enzyme does not reach the brain itself. This is because the brain has a layer of protection known as the brain-blood barrier, which is a natural defense mechanism that lets only select elements enter the brain. As a result, the treatment does not help damaged cells in the brain, furthering intellectual decline. MPS II is an X-linked recessive trait. Males have an X and a Y chromosome, while females have 2 X chromosomes. A carrier mother has a mutated gene on one of the X chromosomes. Each time the mother reproduces, there is a 50% chance that this mutated gene will be passed on to the child. In this case, the unaffected son did not receive the mutated gene. Again, each time the mother reproduces, there is a 50% chance that the mutated gene is passed on to the child, and in this case, the daughter is unaffected. This time, the mother passed the mutated gene on to her daughter. She now carries the mutated gene and will have the same 50% chance of passing this mutated gene on to her children. And now the mother has passed the mutated gene on to her son. The son is affected by the mutated gene, since that is the only X chromosome he will receive, because males receive their X chromosome from their mother and their Y chromosome from their father. MPS. Children are missing an enzyme, which prevents proper cell function and significantly shortens their lifespan.